So I started off with paper charts, and I was evaluating Charm for a little while, and I don't think I gave it a fair chance. I ended up switching to Dr. Kronos. Gosh, there was there were like another two different EHRs that I switched to that were all supposed to make it a lot simpler to chart. Uh, it was sort of an expensive decision to not stick with Charm. And none of them really worked the way that I needed them to. So eventually I came back to working with Charm again. There's a lot of really great features with Charm. Some of the ones that really drew me in included the lab integrations, bi-directional integration. So I can order the lab work through Charm. The request goes through, patients are able to have the labs drawn, and then they come back. The labs are automatically brought back into the chart through Charm. So I really like the lab integrations, online scheduling, and especially that web embed feature. So I have my own website, and it works well. It's very informative. But with Charm's web embed, I'm able to have patients schedule their appointments. Even new patients can schedule appointments at the clinic, request appointment with the clinic online. It saves front office staff time. It saves doctor, physician time. It's really great. I'm very thankful. Absolutely. So I really like the PHR. Most patients in the insurance-based system, I'm not in the insurance-based system. In the insurance system, most patients have a PHR that they're working with. So they're used to that sort of functionality. I'm really thankful that Charm has that functionality built in. It's very easy for me to review the lab work, discuss it with the patient, and very easily share that lab work with the patient. And then when they need to, they have access to it so they can share it with other providers, if they choose to. So in terms of the onboarding, I've been sustaining with paper charts. Charm has a very clever way to be able to get the paper charts into the system. But with the right scanner, you can easily click the scan to chart button and scan in all that prior lab chart work into the system. And it's been very convenient switching from the paper charts and getting them digitized and put into Charm. So there's a lot of self-learning in the process with Charm. Yeah. That being said, when I have come across problems or things that didn't make sense, the support staff have been very responsive to emails and so on. So I do appreciate the responsiveness there. Would I recommend Charm to colleagues? Absolutely, I would recommend Charm to colleagues for several different reasons. Several of the EHRs that I tried in the past, I would put forth feature requests, and I have to laugh. One of the feature requests that I put in with one of the companies, I haven't been with that company for 2 years now, I just got an email saying that they're considering it. Obviously, their goals, the things that these other EHRs are focusing on are not my goals as a clinician. Charm is different. They really do focus on the goals for the individual clinicians. Feature requests that are put forth, not that they're instantly brought about, but they are considered and eventually are incorporated. The conference has been really great. Certainly there's always more to learn. I'm sort of astounded at all the features and always new features coming out with Charm. So it's an ongoing process of coming up to speed. But I've really enjoyed working with the Charm staff and meeting other practitioners, really getting an understanding for how they've made Charm a valuable tool in their practice. So I would certainly recommend any colleague who is thinking about using Charm or you're already using Charm, come to one of the conferences. It's really informative, and it really is an opportunity to see outside of your own clinical box. There's a lot of different clinic types and different populations, and it's amazing how each different practice finds ways to really use Charm in unique ways. Sometimes even the software developers haven't even considered that it would be used in that way. So there's a lot of really great information exchange and sharing.